sweet friends. Welcome to my channel. I just wanted to introduce myself and let you guys hear a little bit about my story. My name is Jeannie, for those of you who are new here. I am 51 years old. I was diagnosed with breast cancer at 45 years old. So this month is my kind of 6-year celebration cancer-free. So going back to 2016, I had a normal mammogram in like the end of sometime in July, and it was normal. Everything was fine. They read the report and gave me the real results, and they said everything was fine. So moving forward, my husband's 50th birthday, I'm just going to go right out there and say birthday sex, he actually felt a lump right here on me, and his face went pale as a ghost, and I said, honey, what's wrong? And he said, you have a lump. Well, it just was odd to have a lump that fast after a normal mammogram. So that was on a Friday evening, and on sorry, this is not very comfortable sitting here without a brace here. So on Monday morning, I went to my oncologist and said, can you examine me? I have a new lump. So him and the nurse practitioner came in, and they did a manual exam and said, you know, I don't think it's anything, but with your history, I have I had a history of atypical hyperplasia. I had my first biopsy, my only other biopsy, at age 38, and it just showed atypical cells. So that just means they're not normal cells and they grow rather rapidly, which identifying these, they could give you a higher risk of developing breast cancer. So I was on some medication for 18 months. I was supposed to be on it for 5 years. That would lower my risk of developing breast cancer back to what a normal person's would be. So this was a few years later. So they said, with my history, let's go ahead and get an ultrasound. So I went on Thursday to the radiologist, and she's also the one that had diagnosed the atypical hyperplasia, that had done the mammogram and sent me for the referral to the oncologist for that. So the ultrasound tech, I'm in there after working all day on Thursday. The ultrasound tech just got a, you know, how they get that look on their face, and she said, I'll be right back. And I thought, okay. Now, I've been a nurse for, now it's 30 years I've been a nurse, but since I was 21 years old, and I kind of know that look. So, I don't know why I can't get comfortable, y'all, sorry. So, Dr. Yancey comes in, and she looks at it with the ultrasound, and she said, She said, let's go ahead and do a mammogram again. She said, I know you just had one, but let's do one again and just blow it up. So they did that and did like multiple views. So she brings me into her office, and there's the screen, and she looks at it with me there, and she said, you have two different very, very concerning areas. She said, you have a lump like the size of an overgrown blueberry on steroids. So it was, you know, yay big right there, and that's what my husband was feeling. And then she said, it looks like you have buckshot throughout that right breast as well. It looks like a bullet just splattered, you know, just she said, and I think if the little splattery ones are cancer, she said, I guarantee you the middle one's cancer. she said what I would recommend is a Rosenberg special. Because I asked her, I said, Dr. Yancey, I said, does it look like cancer? And she said, honestly, yes, it does to me. So I kind of left there knowing it was cancer. And apparently that evening, the oncologist that I've worked for many, many, many years, he calls me at home and says, don't worry about a thing. Dr. Yancey said your ultrasound and mammogram were very concerning. He said, don't worry about a thing. We're going to take great care of you. And when I got the message, I thought, oh, shoot. That means I really have cancer. When the doctor calls you like that, because he doesn't call for any reason. He's never called me at home before, or on my cell phone like that before. So, so the next Wednesday, I think the next Monday, I went for an ultrasound. To my surgeons for an appointment, because they refer you right to the surgeon. And he's the one that did my first biopsy, and they had put me to sleep for that one. And just, this was so long ago, they still use the metal wire and with the ultrasound machine, with the mammogram machine to identify, because it had 7 different areas. And they did 2 wires to localize 2 of the lumps, and then go in while you're under anesthesia and scoop out around where the end of the metal rod is, and that kind of removes what it is. So they gave me the option. I went by myself to this appointment also, and because I didn't know, I think it was the same, it was either the next day or a few days later, and he said, well, what kind of biopsy do you want? And I'm like, what do you mean, what kind of biopsy do I want? He said, do you want like the last time, like an excisional biopsy where they cut it out like with the metal wires? He said, or do you want to just go to our local place, which is Diagnostic Imaging Group, and have them do a punch biopsy or it's like an ultrasound guided punch biopsy. So they take like a device and over and over, and it's like a core biopsy, and they did like 7 different times. And anyways, I didn't know, so I just told him, let's do the outpatient one, so we don't have to go under anesthesia. And anyway, so I went and asked my oncologist afterwards. I said, I don't know what kind of biopsy I need to do. Do I need to do an excisional or a just an outpatient with the ultrasound and the punch biopsy? And he said, either way, they'll find it. If it's cancer, don't worry about it. Whatever you choose. He said, it's just a matter of opinion. I said, oh, well, let's do it the easy way. So the following, like 2 days later, I took off of work on a Wednesday, and my husband took me in, and they did the biopsy. So this is still a week after we found it. So, like, that's it. It's just a week and 2 days after my husband found it. And the doctor came in, and they ultrasounded right, and she did the biopsy right there. She was great. And said they'd get back with me in a few days, and that was on Wednesday. Didn't hear anything Thursday. Didn't hear. Then they have to go back in, and they put a tag in there, like a clip that'll X-ray as well, and to make sure they got the right spot, and to just make sure that there's no bleeding and everything. So I had to have ice packs on my chest all day, and then I went back to work the next day. Well, I didn't find anything out Thursday. Didn't find anything out Friday, and I was kind of a wreck that weekend. The not knowing thing, after I'd already been told I pretty much had cancer, was unnerving. Me and the Lord got really super close that week, because, I fully believe that God will take care of us through anything that we go through, as long as we present it to him, or let go of yourself and give it to God. And so we had quite a few heart-to-hearts that week. I'm not gonna lie, I did cry just once. I think just once, when it was just overwhelming because I didn't know. I mean, just tell me what I need to do. If I need to fight this, that's great. I can do that. Or if I need to just forget about it, but not knowing was very hard for me. So Monday morning I go into work, and we had gone camping the weekend before, and my nerves were, I'm not a nervous person, but it was super hot. It was the first weekend in October, last weekend in September, and we went to St. Augustine and stayed on the beach in our camper. And I'm not kidding you, it was so hot and humid. It was in the 90s, and there was no wind blowing, and we were walking the 2 dogs like in the middle of the day, and they were burning up. They were hot, and we were hot, and I almost passed out. I don't know if that had anything to do with me being nervous about it, but I was a wreck. Anyways, on Monday morning I go into work, and worked about half an hour, and I see the nurse practitioner for my doctor in the hallway, and I said, "Tracy, have you heard anything from my biopsy?" And her head went down, and her voice quivered, and she was like, "I was just fixing to come find you." She said, "I am so sorry, Jeannie." She said, "Your biopsy was positive." And I thought she was going to cry. I hugged her, and I told her it was going to be okay. I said, it's okay. I'm okay. And I said, I know, I'm so sorry that you had to tell me that, because I know it bothered her. We've worked together for years, and it really bothered her. So, I guess fast forward an hour. I didn't tell anybody. I didn't tell my husband. I didn't want to tell him over the phone. So I'm at work taking care of patients, and I get a phone call on my cell phone. And it's Becky at my surgeon's office. And I'm at my desk, and there's people around me. And she said, "I need you to come in this afternoon. We need to discuss your mastectomy options." And I said, "What, Becky?" I said, "I haven't even told my husband that I have cancer yet." She goes, "Sweetie, it's time." She said, "You need to tell him, because we need to get you on the books for your mastectomy." And I'm like, she said, "So we'll see you at 3:30 this afternoon." And I'm like, well. So one of the guys at work overheard me, and he goes, "Oh my God, I'm so sorry." And I'm like, "It's okay. I mean, we got to deal with this." I said, "I haven't even told my husband yet." I said, "I'm going to have to tell him some way. I don't want the doctor to tell him." So I called my husband and said, "The surgeon wants to see us this afternoon." And of course he thought the worst, but I told him that we needed to see him at 3 and not 3:30. Well, I met him in the park. I said, "I'll meet you in the parking lot." So I made him come and sit in my truck, or I sat in the truck with him, I can't remember. And I let him know that the biopsy was positive and that I had cancer, because I didn't want a stranger to tell him. I mean, he had met Dr. Pickens a few times. I said, but I just didn't want him to have to, I didn't want him to have to hear it from somebody else. So I was just straight up honest with him. I said, I just wanted to let you know. I said, "We are seeing the surgeon." I said, "Because my biopsy turned out positive. I have breast cancer." And I said, "I have 2 different kind of breast cancer. I have invasive intraductal breast cancer, and I also have ductal carcinoma in situ, which is just almost like a precancerous thing, but it's considered breast cancer." So I had 2 different kinds of cancer, but we didn't know anything else. So we went in and saw him, and he said, "I definitely want to do a biopsy." And I told him, a mastectomy. And I said, "Well, I want a double mastectomy." I said, "With my history, and we already know I'm at risk for breast cancer." I said, "I don't want to go through this and then have to go through another one in the, in several months or whatever." And he said, "Well, we'll take care of that after you heal up from your first one. And if you have to do chemo," he said, "apparently this is pretty rapidly growing, he said, or we wouldn't have found it like we did. He said, for you to develop this size of a breast cancer with 2 different kinds of cancer in just such a short time after having a regular mammogram, he said, we don't need to plan on any reconstruction or anything for at least 6 months. He said, we need to make sure that we have this cancer out of there. And I said, that's fine. I said, but I want both of them off now. If you're going to do one, I want you to do both. And he said, no. He said, if you don't heal up from that, the one that's optional, he said, then we can't start your chemo if you need chemo. And I said, I don't care. I said, I'm very active. I was a runner at the time. I was training for a half marathon. I was probably the fittest I'd ever been in my life. And I was currently training for a half marathon in St. Augustine that was going to happen in December. I said, I plan on still being very active. And I said, I do not want to do one and be lopsided and then have to do the other one in a few months. I said, I don't have that much time off at work. I don't have short-term disability or long-term disability. I said, I want to do this. I said, I just want to get them over with at the same time and be done. And he's arguing with me. And then my husband says, both of y'all, because I had already told my husband, I said, I don't want just one off. I want both of them off. And I said, and if he doesn't want to do that, I will find a different surgeon who will. And so we're arguing back and forth. And my husband finally says, both of y'all, stop it. He said, I need to understand why you want both off and why he doesn't want to do but one, or why not do them at the same time. So I need to hear. Okay, so he explained it to him. He said, if you really, really want this, I want to go ahead and do it. I said, I really, really do. I said, I don't want to play this game. I just want them off, be done with it, and we'll go from there. Well, so they decided to do my mastectomy, my double mastectomy, the 25th of October. So we got back from Texas on Friday. I worked on Monday most of the day, and then I had a pre-op appointment with the doctor. My parents went with me for that. Got everything. We didn't finish up till like 6 o'clock at night or something, but I had to be at the hospital at like 6:30 in the morning, 6 or 6:30 in the morning for my mastectomy. My mom and dad were there. One of my friends, who's actually a former patient of mine, my son and my daughter were there. And of course my husband. And my daughter looked at me and she goes, Mom, why are you so relaxed? She said, you don't seem upset about this at all. You don't seem like you're here to get your breast removed. You just seem to be so at peace. And I said, honey, God gives you that. You know, the thing they say about peace beyond all understanding, that's what I had. I wasn't worried about it at all. I wasn't worried about the cancer being so bad or living without breasts. The way I thought of it is we're removing the cancer. I know it was my boobs, but I didn't think anything about that. We had told the children we found out on Monday, and we told them to be all at the house on Monday evening, and we told the children then, and you know, they're all grown, but it still was really hard for them. So we told them then, and anyways, my mastectomy, I was able to, it was outpatient. The doctor recommended me not staying overnight at the hospital. And I said, why? Why do you prefer that? I said, won't I be in a lot of pain? And I tend to get nauseated when I have surgery. And he said, absolutely not. He said, I do not want you to stay. He said, I'm not worried about you getting infection outpatient at home. He said, I am worried about you getting infection in the hospital. He said, I want you to go home that evening. He said, rest, and then I will see you, I think it was Friday morning I saw him. I can't remember. Anyways, but everything went fine. I got to go home at 9:30 that night, and I was starving because I hadn't eaten since the night before. Well, we stopped at McAllister's Deli. I got a, half a sandwich and some soup, and I ate just a tiny bit, and we drove home, which is an hour home. And I got home and felt nauseated. I wasn't hurting at all, but I felt really nauseated. So they had given me pain medicine. I didn't need any. I had taken Tylenol and Advil, but I took some anti-nausea medicine and went right to sleep. Well, when I got up the next morning, my husband stayed with me. I hadn't even been up to the bathroom by myself, and he helped me to in front of the bathroom because I'd been like laying on my back all day, and everything was fine. I wasn't hurting or anything. I did really well. Well, the next day, we had prearranged for my mom to stay with me, and she didn't get here until like 9:30 in the morning. So he made me promise not to leave the bed until my mom got here. Anyways, by that afternoon, I was up putting food in the crock pot so my husband wouldn't have to starve. My mom didn't make any. That's a whole different story, but it all went well. I healed very well. I had a drain in each side, so a drain hanging on my hip here from my breast and a drain on the other side hanging from my hip. And I didn't have any problem at all, except for probably a week later, I got one of the drains taken out on October 31st, and I went and saw my oncologist the same day after I saw the surgeon. I still had to keep one in because one was draining a lot. The right one was draining a lot. And that was the one I had cancer in. And they also, at the same time, they did the lymph scintigraphy, which is where they go in and check the lymph nodes. They put dye in to make sure the lymph nodes don't light up. Well, originally they said, no, they do not. They're not lighting up, but they would have the final pathology because they still take one of the lymph nodes out of your armpit out. That was fine. Everything was fine with that, thank God. So I went and saw my oncologist that afternoon with my mom, and the doctor said, "I am so sorry," and he hugged me. He said, "We got the mammogram results on you," and I said, I didn't exactly know what that was, but it's a test that they do on the tumor, and it either determines if you're high risk for recurrence or low risk. There is no medium, no nothing. High risk means you take chemo. Low risk means you don't have to take chemo. But I was on the high risk area, so I had a high risk for recurrence. So they said you need to take chemotherapy, and after that's over, we'll start you on some endocrine therapy, which is like a hormone blocker. I found out my tumor was ER/PR positive, HER2 negative, which honestly is the best kind to have. So it was high risk for recurrence, but if you had to choose a breast cancer, that would be the one to get. So we went ahead and got my chemo on the books for November 17th to give myself 3 weeks to heal. So I was able to return to work 3 weeks after my mastectomy. We had the second drain removed a week later. Actually, my daughter pulled it at home. You just can pull it. It was quite the experience though, because I had to have help in the shower, and I didn't have any pain. It just it got sore. I didn't know to wear a lanyard with my drains hooked to it while I was in the shower. I didn't know because nobody had ever told me, and I've never worked with mastectomy patients. I mean, I see them all the time, but not like when they're having it or when they're showering afterwards or anything. So I learned along the way. So I remember my daughter coming over right after I had my mastectomy. It was like 2 or 3 days after, and I hadn't taken a shower by myself, and I wanted her to sit in there with me because in case I got dizzy or needed help. I really like to have help getting in and out of the shower. I didn't want to fall. I had borrowed my mother-in-law's shower seat, but it still was a lot to get in and out with 2 drains and everything. Anyway, she came with me, and as soon as she got me in the shower, I hear her sitting on the toilet crying. And I said, "Baby, are you okay?" She goes, yeah, she said, this is just so hard. And I said, sweetheart, I know it's hard for you. I said, when you have cancer, everybody that cares about you has cancer. I said, it is not, it just doesn't affect you. I said, I know this is hard. I said, but you know what? Your mama's going to try her hardest to be brave and get through this without any problems. And I said, and I appreciate you so much being here. And I was so proud that she cared like that. But it hurt me that it hurt her. But I mean, you can't really help it. You just do what you do. Anyways, I also found out that I had the genetic testing done, and I found out that it doesn't run in the family. It's not genetically, it wasn't a genetic type of cancer. Um, so that made me feel good because I have a daughter. And the sons aren't usually at risk for that, for breast or ovarian. So my BRCA testing was negative, which I was so happy about that. So anyways, I came back to work on Monday, and I came back to work on Wednesday and started chemo on Thursday after my mastectomy. This was 3 weeks later. And then I worked on Friday. So I received 4 cycles of Taxotere Cytoxin with Neulasta. And I did really well with it. My hair came out all the way on day 13. I was bald. It was, I went and saw my hairdresser that afternoon, but earlier in the day, my coworker, my hair was probably about a little bit shorter than this, but one of my coworkers had my hair draped around like a Fu Manchu or whatever it's called, and was teasing. We were having fun with it. We had to, but my coworker surprised me with a goodie bag for chemo and a quilt from the church workers for my chemo, and they were just super sweet, and everybody was so nice. And anyways, very, very supportive. Day 13, I went to see my hairdresser because my hair was just falling out in chunks. I had tried to wash it that morning and then tried to blow dry it and then like straighten it, and it was coming out in chunks as I was trying to straighten it like this. First when I got out of the shower, it looked like a cat. Like, I mean, there was a pile of hair. It looked like a cat was in the shower with me. And then I tried to style it as well the next day and that morning, and it just was a mess. It was my hairdresser, the same one I've been going to forever, said, sweetie, I tried to leave it about 1 inch long. She said, but you have too many bald spots. So, okay, so I went to work the next day with my head shaved, and but it was like already gone pretty much, like completely. And so I wore a little head wrap thing because I didn't have a wig yet, and I didn't really want one, but I'd heard terrible things like they're uncomfortable and they're hot. Well, quickly learned that they're both. I wore a little head wrap, kind of like a tube thing, and then just tuck it into the back. It was cute and colorful. It was really sweet. And I got to work, and they're like, why are you wearing that? And I'm like, well, my hair's gone. I know, but why are you wearing that? And I said, well, I don't want to make anybody uncomfortable with my bald head. And they're like, you do know where you work, right? So I'm an oncology nurse. I worked at the same place I got treatment at. And anyways, I just didn't want to make anybody uncomfortable. Well, when I took my head wrap off the first time, I had a hot flash. Everybody's like, oh my God, you look so beautiful and your eyes shine so bright and blah, blah, blah. So everybody was so sweet. The patients absolutely loved it. They told me, I had so many people tell me, you're so beautiful and you're such an inspiration. And, I always try to keep a smile on my face. I thought to myself, if I got to do this, hopefully I'll only have to do it once ever. And I want to have a smile on my face through it. So just about every picture that I have of me going through that, I'm smiling because there's a season for everything, and that was my season. And I ended up taking 4 cycles. I had to delay 1 week delay a week because I had some stomach issues. Like they thought I had gastroparesis, so I had to drink that gross chalky dye and get some stomach tests and like an upper GI and a whatever. anyways, I felt full all the time. I felt like I couldn't breathe because I started looking like I was very pregnant. It just was, I guess my GI system slowed down because I was full all the time and I couldn't go to the bathroom either. So it was just a process. I ended up finishing chemo with no hair and no boobies on January 26th, 2017, I think. Last chemo, and they brought me a cake and balloons, and I was so grateful to be done. My husband and my daughter both showed up, and bringing me to chemo, and all in all, it was a pretty positive experience. I mean, a lot more positive than it could have been. So I didn't want to schedule my reconstruction because I didn't have any time left. I ran out of PTO and I didn't want to schedule it. I'm like, I am not going to let my family be hungry because I want boobs. I didn't believe in doing that. So my nurse, my practice manager, she just kept encouraging me to go ahead and schedule. Well, I had to see my reconstructive surgeon before my mastectomy even happened so they could determine the best way to cut you aesthetically to get the tumor and to make it look better afterwards. And he chose the up and down method. And so anyways, she said, just let's get it on the books and don't worry about scheduling it or anything. She said, let's go ahead and just get it on the books and we'll know what we have. And I'm like, okay, I don't know why you're pushing so hard, but okay. So I got it on the schedule for the day after Mother's Day, 2017, which was, so that put me boobless for like 7 months. It was really weird. I couldn't wear a bra. I just would wear one of those undershirts with the shelf bra in it. It just didn't work. I tried one time. We were going to Washington, D.C. to march on Capitol Hill for patient rights. My husband and I were traveling together because I didn't want to go alone, but they chose me to go up there. And I had my material girls, is what I call them. I had my little, the little breast, the little fabric-y things that you put right here. The little fake footballs, whatever they're called. And I had them tucked in my bra underneath, so it looked like I had some boobage, is what I called it. And my hair was about, because it was just in April, the end of April. And we are fixing to land, and I'm powdering my nose, and I look down, and I have a boob in my chin. A boob. Okay, get you. One of the little footballs was in my chin, and I was like, okay. So I took both of those out and put them in my carry-on because I just felt silly. So I'm like, the only days I always wore my wig, dressed up. I put my material girls on, whatever they're called, and wore my wig on those days because I wanted to feel pretty. I wanted to look pretty. I thought, I could make the best of it by that. And the patients absolutely, of course, they recognized me when I came in there, and they just loved seeing me. And it was just such a blessing to have their encouragement, to have my coworkers' encouragement. So anyways, I had my first reconstructive surgery where they take your tummy fat and bring it up to make mounds on your chest to make boobs. They also take an artery from your stomach and microsurgically bring it up underneath your, all the way up, and it supplies blood to your breast, your new breast, because if they don't have circulation, they die. And this way they are warm and soft, and it's just, I think it's kind of funny now. I have my mommy stretch marks from having my babies up here now instead of on my stomach, because my stomach's completely fine, but I have here. So I ended up having that surgery. You're in ICU for 4 days. So I had, hey sweetie, I had the surgery on the day after Mother's Day, so a Monday, and I got to go home on Thursday, but it was kind of weird because I had, everything was going great. I came back from ICU, from the operating room to post-op, and they brought me right to ICU. And I was beside myself. I couldn't understand why I was hurting so bad. And the nurse was wonderful. To this day, I still remember her name was Bonnie, and she was probably in her 50s, and she was a fantastic nurse. And she said, I'm not sure what's wrong. She said, but let's check your IV. And I was kind of already talking myself off the roof. You know, I was feeling, I don't know, I guess I would call it overwhelmed. I was feeling like, okay, you asked for boobies and you got them. I was hurting, just overwhelmingly hurting. And I was glad my family was still away. My daughter and my husband were the only ones there with me, but I'm glad that they had stepped away for a little bit. They had gone out to the car or something. And the nurse says, does your IV hurt? I said, no, it doesn't. She said, oh my gosh, it's infiltrated. It's not working. She said, let me change it real quick. And so she started a new IV. I mean, in like 2 minutes, she had morphine or something in me, and I felt like a new woman. I was like, oh my gosh, whew, I can live with this. So, so fortunate. I was able to ambulate that evening, get up and walk around. They come in every 30 minutes and check that artery and make sure it's circulating, so it sounds like a heartbeat. And so every 30 minutes they flip on the lights. I had these little an eye mask that, so they could do it without disturbing me. They'd check every 30 minutes to make sure the blood flow was there, because if the blood flow stops, that means the tissue will die that they've just transported to there or transplanted to there. So everything went great. The next day they were able to get me up and get in the shower, and they said, we want you to bathe in the shower, and we'll stand right outside. Anyways, that's the first picture you'll see. I'll show it to you, but I was cut from hip to hip. There was 2 drains in my pubic area, so they were draining the blood, and then I had a drain here and a drain here, and I had a pouch of like pain medication that was attached to my belly here in a pouch as well. I got up and bathed and did great. I was pleased with how I looked. I mean, I was very swollen, but everything was great. I healed very nicely from that, but it was extremely painful. It was probably the hardest thing I've ever had to do, other than tell my children that I had cancer. That was very, very hard. But gosh, it was extremely painful. I went for my 1 week checkup and everything was great. I can't remember when they took the drains out or when they didn't, but my swelling had gone down a lot. I think they took out, I don't remember when they took out the drains, but everything went well with that. I could not drive for 8 weeks. They tell you can't drive for 8 weeks because if you get in an accident and it pulls that artery that they just transplanted, that tissue could die again. So they don't want you driving for 8 weeks. So my daughter was driving my brand new Jeep back and forth to take me to the doctor or whatever. And occasionally we would go, I'd have to be out of the house, and we'd go to the dollar store or something. But 2 weeks after my surgery, they said, okay, you need to get off the pain medicine, period. And I was like, are you sure already? Because, I'd kind of be up and overdo it a little bit, and I'd get teary and have to lay down in the afternoon because it was just overwhelmingly painful. So I just started switching to Tylenol or Advil and just kind of tried to slow myself down a little bit, because I'm not one to just lay down and rest much. So I did great with that. Went back to work after 8 weeks. And then my second one, that was in May. And my second surgery, where they try to shape them more into breasts, the mounds more into breasts, that was in August. And everything went well with that. Then I think the third one was like a transfer, so that fat transfer, so they take it out of your hiney or your legs or whatever and try to shape them more into breasts better. Well, I was due for my fourth one, and it was supposed to be just the nipples where they, kind of do an origami sewing pattern to make you have little sticky outies. And I thought I was ready for that, but the nurse started asking me about it, and she was wonderful. But I started crying. I was like, I am so unhappy with how I look. And she goes, tell me what you want and what you're unhappy with. Well, I felt like a linebacker. My breasts were wide out here, but I had no projection whatsoever. So I was almost flat, but they were wide and not sticky outy. So she went and talked to the surgeon, and they said, okay, we know what we want to do to get you looking like you want to look. And the doctor, he's amazing. Dr. Jason Rosenberg, he's just wonderful. Him and his staff, they were just amazing. Anyways, the surgeons, the next time they got me into surgery, which was just another week or so later, instead of doing the nipples, they decided to almost like shave me down this way to make me less wide. And they put little tiny implants in the front to give me some projection. Well, I was about perfectly sized after then, but I've gained like 60 pounds since, so y'all know that. I healed well from that. That was nothing to have that done. Even though I'm cut almost, you have to turn sideways to see where I'm cut to on both sides. And I had multiple belly revisions. Sometimes they would cut this whole breast open to get it to where it needed to be. Of course, I'd only take 3 days off and go back to work. So anyway, I had my nipple surgery in September, the last surgery in September of 2018 or 19, I can't remember, but that was the last surgery that I had. I had a little bit of trouble healing from that because first of all, when I had my mastectomy, the right one didn't want to close all the way. It took me forever because I started chemo so quickly. So it drained and we had to pack it and stuff, but it all worked out. And then with the nipple one, I just kept, the tissue kept sloughing off because that area doesn't have quite as good a circulation. So it just sloughed off and sloughed off. But anyways, it ended up, I've seen other friends have it done and their nipples look the same as mine. Well, I finally, we got an invitation, my husband and I got an invitation to go down to the Keys with a couple of our couples. And so I said, oh my gosh, I'm going to look for a nipple artist down there, a tattoo artist down there that does paramedical reconstruction tattoos. So I had heard about this lady, Suma Inc. It's the name of the business is called Suma Inc. And she's a tattoo artist that actually tattoos nipples that are very real looking onto women who've had some medical reason why they don't have nipples anymore. And so I had my first one done in June of 2022. No, June of 2021. And I had the tattoos done. And oh my gosh, I almost cried. I was so giddy. They looked incredible. It was something to look at other than the scars. So it was amazing. I went back in September because you have to have a touch up. Went back in September when we went back for my husband's birthday. And because we knew we had to, we were like, oh, let's go back to the Keys for a week. So we took our camper down there, and her and her partner that is also an artist there in Homestead. And oh my gosh, anybody that's ever had this done, if you want nipples again, she actually colors them where they look real. The areola, the nipple part, everything, they're just amazing. So she did incredible. And I feel like my journey is over now. I had a scare maybe 2 years ago. I was having awful headaches and dizziness. Felt like I was going to pass out with them. It's terrible. They tested me for brain mets just to make sure I didn't have the cancer spread to my brain. Everything was fine. And really, other than that, other than one issue where I had a lot of back pain, I don't think it's anything, and they didn't think it was anything. So other than that, I have not had any scares other than that brain one. They thought the cancer had spread to my brain, but I am 6 years out. I'm healthy, happy, other than being a lot heavier now than I was then. But I was running like 40 miles a week, so I'm healthy. I'm vibrant. I'm no longer running because I have a lot of joint pain, and it's really hard to run when you're chubby. I don't know if y'all know that, but it's a lot easier to run when you're skinny. So, which is kind of it just kind of goes hand in hand. So, I'm so blessed to be healthy, and I wanted to share my story. So, if anybody is going through this, I am a good resource to use. Or if you find something and you're scared to go get it checked, please don't be scared. If you can catch it early, your story can be like mine. You're healthy and happy, and you just have a history of cancer. I mean, it's not like, oh, I'm dying of stage 4 cancer or living with stage 4 cancer. I am cancer free, and I am so glad of that. And if I can encourage anybody to go get checked because of my story, or to have your partner check you and you go get checked, or whatever. I mean, it's not just for breasts, it's for men with, with testicular cancer. It can happen so young. Or, if you guys see something or feel something irregular on your body, go to the doctor and get it checked. I mean, it's as simple as that. I mean, sometimes it's bad news, but it can get you in a better place. I mean, even if they find it and it's bad, it's better to get started on treatment now than in, another year when it's found. Because if I'd have waited for this, when I had my mammogram in July, if I'd have waited till the next July, I may not be here to tell this story right now. So, like I say, if I can tell one person my story to help them get through, to help them to be healthy, I'll be glad to do it. Y'all refer this video to whoever you want to, friend-wise. I'm going to include a lot of pictures from my journey, and please feel free to reach out if you have a story you want to share with me. But each year I'm going to try to do this. I did it last year, and I just wanted to give an update this year just because my channel's grown a little bit, and I want people to know what to expect and what could happen. So to me, this is a success story. I mean, this is a testimony of early detection. I mean, I'm so glad that the doctors listened to me when I went to the doctor, and that my husband found it. I was horrified at first. I'm like, oh God, I ruined his birthday. He goes, baby, if I can help you get through this, I'm so glad that we found it. He says, because if we'd have waited, he said, there's no telling what we'd have been up against. So I am so blessed, and I just wanted to share my story with y'all, and I hope y'all are well and stay well, and I hope y'all have a wonderful day. And thank you guys again for watching my channel and subscribing, and thanks for liking this video, and I hope y'all have a wonderful day. Thank you so much. Bye-bye. Hey, Barky.